So I've had many students ask me, Mike, can you help me with heart blocks? The answer is yes. So I can't just jump right into showing you what a heart block is without telling you exactly what's going on. Okay, so an impulse of electrical conduction starts here at the SA node. Now understand that it travels from the SA node down into the AV node. Here it's delayed to allow the atria to contract and fill the ventricles. This delay is normal function of the AV node and usually causes no signs and symptoms. But understand that occasionally that this impulse can be delayed more than normal. This is known as an AV block or a heart block. So of course we have to start here with first degree block. Now the first degree block, all I'm paying attention to is those PR intervals. Now if you could tell on this one, they look delayed. How you look at a PR interval is at the start of the P wave to the start of the QRS complex. A normal PR interval is going to be less than 0.20 seconds, which would equal out to less than 5 small blocks on an EKG paper. If it's greater than those 5 small blocks, it's considered a first degree block. See how all these beats are regular. They're all the same every single time. This makes it a first degree block. In the emergency setting, this is nothing to worry about and we do not treat this. So let's go ahead and take a look at second degree type 1. If you notice, there's a QRS complex that's missing. Whenever you see a missing beat like this, you always have to think that this could potentially be a second degree block. Now with second degree type 1, you will notice that there is a different length in the PRI. Alright, we call this going, gone. It keeps increasing in length or duration. Typically this second degree type 1 is either occurs in the AV node, could occur in the bundle of His, or even the Purkinje system. Do note also that the R to R intervals are considered irregular. So for treatment, usually we can actually leave this alone as long as their cardiac output is good and their ventricular rate is normal. If they start becoming bradycardic, then we could treat this with atropine. So now let's go ahead and take a look at second degree type 2. Understand this is a little bit more dangerous than second degree type 1. Usually this occurs within the bundle of His or more commonly in the actual bundle branches themselves. Now if you notice, there are still missing QRS complexes, but take a look at those PRIs. The distance or the actual duration stays the same. When talking about treatment, believe it or not, atropine is actually ineffective in reversing this type of block. Usually the need for transcutaneous pacing is necessary. The last AV block that we need to talk about is a third degree AV block, which occurs when all impulses reaching the AV junction are actually prevented from going to the ventricles and creating a QRS complex. Because of this, this block is known as a complete heart block or complete AV block. Because all these impulses from the SA node are actually blocked from going down to the ventricles, a secondary pacemaker actually has to kick into effect, and this is why the heart rate is so low with a complete heart block. So if you look closely, you can tell that the P waves are actually on time with each other and the QRS complexes are on time with each other, but they kind of don't talk to each other. So they're both working on two different rhythms. Now pay close attention to these patients with third degree blocks. They could cause a heart attack or even sudden cardiac death. And because of that, most of these patients actually are going to require pacing. So there is a trick that I try to do with my heart blocks whenever I do print one out. And I'm trying to find the P waves and see if they're correlated with each other. So what I do is I usually grab a sheet of paper or something inside the truck and I mark where I think I have P waves. All right, I think that's a P wave here. They look similar. All right, so now what I'm going to do with this sheet of paper is I'm going to go ahead and move it and see if it lines up with possible other P waves. All right, so right here, this one would be lost inside that QRS complex. Right here, I have that upward deflection. If I go and move this sheet of paper again, it lines up. All right, so all these P waves are lining up perfect. And as you can see, these QRS complexes are lining up perfect as well. Because of this, they do not correlate together. This is a third degree or complete heart block. Let me know if this helps and if you have any other questions and want me to cover anything else.